To truly understand why babies cry, we need to look deeper, not just at behavior, but at the brain itself, because behind every cry is a rapidly developing nervous system trying to make sense of the world. Do different cries really mean different things? Many parents ask an important question. Can you actually tell what a baby needs by the sound of their cry? Science suggests the answer is yes, but not in the ways social media often claims. There is no magical code where one sound means hunger and another always means pain. However, studies in infant acoustics show that cries do vary in pitch, rhythm, and intensity depending on what the baby is experiencing. For example, hunger cries tend to be rhythmic and repetitive. Pain cries are often sudden, high-pitched, and intense with very little pause. Discomfort or tiredness cries usually sound fussy, irregular, and gradually build in volume. These differences exist because different parts of the brain and nervous system are being activated. Parents do not need to memorize sounds. Instead, they learn patterns over time. This learning happens naturally through repeated, calm interaction. What happens in a baby's brain during crying? When a baby cries, its brain is not misbehaving. It is processing stress. Newborn brains are unfinished. The areas responsible for emotional regulation, particularly the prefrontal cortex, are not yet developed. This means babies cannot calm themselves down. They rely on adults to help regulate their emotions. During crying, stress hormones such as cortisol rise in the baby's body. Without support, these levels remain high. But when a caregiver responds with soothing touch, voice, or movement, the baby's brain chemistry changes. Cortisol drops. Oxytocin, often called the bonding hormone, increases. This is how emotional regulation is learned, not through independence, but through connection. Why ignoring cries can backfire. Some parenting myths suggest that responding too quickly to crying spoils a baby. Science strongly disagrees. Multiple long-term studies, including research conducted in the UK, show that babies whose cries are responded to consistently actually cry less over time. Why? Because they learn trust. When babies feel safe, their nervous system settles more quickly. Ignoring cries does not teach self-soothing, it delays emotional development. Self-soothing is a skill that develops later, once the brain matures. In infancy, co-regulation comes first. The parent's nervous system matters too. Crying affects adults just as powerfully. When a baby cries, the adult brain releases stress hormones as well. Heart rate increases, breathing becomes shallow, anxiety rises. This is not weakness. It is biology. However, babies are extremely sensitive to adult emotions. They can detect tension in voice, muscle tone, and facial expression. When the caregiver is calm, the baby feels safer. When the caregiver is overwhelmed, the baby's stress can increase. This creates a loop. Understanding this helps parents pause, breathe, and reset before responding. Taking a moment to calm yourself is not neglect, it is preparation. Why rocking, holding, and gentle sounds work? Many soothing techniques have stood the test of time. Rocking, white noise, soft singing, skin-to-skin contact. These are not habits, they are neurological tools. Inside the womb, babies experience constant movement, sound, and warmth. After birth, Sudden stillness and silence can feel unsettling. Gentle motion and rhythmic sound mimic the prenatal environment, helping the brain transition to life outside the womb. This is why babies often calm when held close or rocked gently. The nervous system recognizes familiarity. Colic, when crying feels endless. One of the most challenging experiences for parents is colic. Colic is defined as excessive crying in an otherwise healthy baby, often occurring in the late afternoon or evening. Despite decades of research, colic does not have a single cause. Theories include digestive immaturity, nervous system sensitivity, and sensory overload. What science does agree on is this: colic is temporary, and it is not caused by poor parenting. Babies with colic are not broken. Their systems are simply adjusting at a different pace. Supporting the caregiver during this phase is just as important as supporting the baby. The critical window of emotional learning. Every time a baby cries and receives comfort, something remarkable happens. Neural connections strengthen. The brain learns that stress can be resolved. This process lays the foundation for emotional resilience later in life. Children who experience consistent, responsive care in infancy tend to show better emotional regulation, lower anxiety, and stronger social skills as they grow. This is not about perfection, it's about presence. When crying feels too much. There are moments when crying becomes overwhelming for every parent. If frustration rises to a dangerous level, it's essential to pause. Placing the baby safely in a cot and stepping away for a few minutes is far safer than trying to push through intense stress. Seeking support is not failure, it is responsibility. No one is meant to do this alone. The big picture. Crying is not noise, it is information. It tells us about hunger, discomfort, fatigue, emotional need, and neurological development. When we listen with understanding rather than fear, crying becomes less intimidating, it becomes meaningful, and with time, confidence grows.